Can you just talk about, as a doctor, your approach to getting people off their medication? How fast do you do it?
Yeah.
How does that work?
Well, she was a particularly amazing story. And the reason why she was so amazing is I had never seen a human being on that much insulin before. Just to give people who don't know insulin, just to understand how much insulin she was taking. So she was being treated by an endocrinologist for many years who, I guess she had had diabetes for about a decade, treated with insulin and oral drugs because the oral drugs weren't cutting it. Then the insulin wasn't cutting it. She had been up to 150 units of Lantus every night, plus 3 different shots of Humalog of shorter acting insulin with every meal. And her sugars, she had a hemoglobin A1C on that regimen. And for people who don't understand hemoglobin A1C, that's the sugar averaging, that's the most accurate long-term test that runs over 3 months to show how much sugar coating you have in your red blood cells. And it's really a good way of showing how controlled your sugars are. Hers was like 12 on the maxed out insulin level, maxed out 3 shots daily of regular insulin, and maxed out pills. I did not know this was humanly possible. So, her sugars were still on that regimen. They were 300. What do you do with a lady like this? Give her sweet potatoes.
I love the response.
She came in. This lady is a nurse practitioner, and she came in. Her name is Joyce. You can read her story. She's one of the most wonderful people you'll ever meet. She came in to us, and she said, whenever people come in to see us, they have to fill out an application first in order to see us, so that we can get all of their personal information. And one of the last questions we ask is, what is your goal in coming here to see us? And she wrote as her goal, her desire is, she wants to someday go back to become a nurse practitioner to help people again. She was so critically ill, she was on disability. She had to quit, and she couldn't, because she had many other problems, including horrible ulcerative colitis, almost died several times from pulmonary emboli, a lot of different problems. The diabetes was one of the least of her problems. So when she said that, of course, she had never heard about plant-based whole foods. She's a nurse practitioner who treated diabetes. She's looking at all this insulin is on, and I said she's going to eat rice and sweet potatoes and greens, and she was looking at me and a little surprised. But she believed in what we were saying, and she was dedicated. Over day 1, day 2, day 3, day 4, her sugars rapidly plummeted so quickly. And we're, based on our experience, we're kind of prepared for this. It's very dangerous when you're having someone who's taking insulin. Someone who's only on oral agents, on pills for diabetes, I just immediately stop those as soon as they begin the 30-day challenge, the beginning of our program, because I know that the foods we'd be working in a day or so, and I know they'll be effective, so I'm not worried about their sugars going up once they immediately stop the medicine. But I was very concerned about this lady because she was on such massive doses of insulin. And even if someone is on moderately large doses of insulin, the plant-based foods work so quickly, like within the day, 2 days, that they could become a person who's taking insulin and eating the plants could get a sugar of 30 or 40, black out while they're driving, fall down the stairs, break their neck. So I immediately, as soon as they start, I hedge my bets, and I immediately, maybe depending on how much insulin they're on. For Joyce, I told her to drop her Toujeo, this powerful supersaturated insulin, from 150 I believe, to 130 or 140, cut it by about 20 units. And she was constantly monitoring her sugars 3 times a day, was calling me several times a day. And in the first week, 2 weeks, 3 weeks, we were monitoring her sugars and giving her directions a couple of times a day, sometimes dropping insulin 2 or 3 times within the same day. So rapidly did her sugars come down. And believe it or not, by the end of the month, I'd have to get the exact time frames, but she was almost off all of the insulin. We stopped all of her oral agents on the first day of the challenge. And within, I believe it was 5 weeks, she was on no more insulin whatsoever.
You got her off of all insulin in 5 weeks after having taken more insulin than anybody you've ever seen in your life.
Yes.
That's incredible.
And more than was recommended by the manufacturer. And and her sugars at the end of 5 weeks, on being on no diabetes treatment other than eating plants. Of course, she is one of the individuals we had to be very careful with starches with, because she had high levels of visceral fat and she was sensitive to them. She did very well on the 30-day challenge, but going forward to continue her diabetic and weight improvements, we thought it would be best to limit starches in her. But they worked fine in the first stages. And, her sugars at 5 weeks were in the low 100s, like averaging 100, 110, on nothing other than eating plants, 115, maybe sometimes 120. Between 100 and 120. I think back to the days in medical school where, they said things like this are not, you just have to keep, that's right, you have to keep managing these things, just keep giving people medications. You can't help them reverse it or cure these things, and it's not true.
Yeah. And I read in the Forks Over Knives article, she also got off a lot of her other medications. She was on over 15.
She was on 24 medications.
Yeah.
She was on ulcerative colitis, which she almost died from. She was off all medication, on enemas, on oral medications for years, active. Within a month, she was off all of them. All of her massive pain medications, off of them.